most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrubb, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad's
Bob.
getting buttoned up. Okay, today we're going to talk about how to decompress your shoulder, fix pain. So this was based upon years ago. We first came across this book. I think it was a patient or a subscriber told us, right?
Yeah, he sent a comment. He said, this book, you know about it. And
you told me, and I ordered it.
Yeah, so we both read it a number of years ago and then become believers.
It's called Shoulder Pain. It's by John M. Kirsch, MD. He's a orthopedist.
Yep.
Or was orthopedist.
Retired now.
Board certified. And we were skeptical.
Oh, yeah.
At first. He uses it for after with shoulder impingement.
Right.
And if you're headed towards maybe surgery.
Right.
For rotator cuff repair.
Do this prior to surgery, and a number of his patients didn't need surgery after doing this treatment.
Amazing testimonials in this book.
I
mean, just some of the most amazing ones I've seen. So basically, he says, and this is part of the decompressing your shoulder. You're basically putting some traction on it. So you can do that with any really hanging device.
Yeah, you can use a pull-up bar,
a branch, a rafter. So,
yeah, he does have some real unique ways of developing your own pull-up system if you don't have something in your house.
And Brad's doing this now because you're having trouble with the shoulder, which we think might be your labrum.
Yeah,
we're not
sure. I mean, I've been swimming for 20 years, so who the heck knows what happens with your shoulder after doing that. But anyways, I do it. I like to do it against the wall, and that's why we developed our hanging handles. I think it works good enough or better. It just feels better. Plus, it works your posture with it.
It works your back too.
Right.
Decompression on your back. But we're going to show you some options here. So, Brad, you're just doing basic hanging right now, right?
Yes.
You're doing. You're grabbing on.
Yep. Just like that.
And you slowly worked your way into it. I mean, you didn't put full weight on it to start, correct?
No. And I slide down slow because I do it in the morning after I get out of bed for 15, 20 minutes. I'll slide down and it takes me 5 or 10 seconds before I put my full weight on it. Because it's pulling my back, it's giving traction to my back, and it's just nice not to at this age
to jar.
Yeah. Right away in the morning.
But you do pick your feet up at one point? Mm-hmm. And how long do you hang then? I mean,
20 to 30 seconds.
Right.
Now it's when my grip gets tired.
You got to develop, your grip's got to develop over time or you won't be able to do this.
Right.
But the nice thing about the hanging handles, here's some other options. One, you could just hang with one arm.
Right.
So you could just hang like this and again, put pressure on it.
And this is where you want to gradually go because you're putting a lot more stress, obviously twice as much weight through it. So you're going to do it slowly. And if it creates pain, then you're going to have to use good judgment.
You really want to do it one day and then check it out the next day and see how it did.
So
because it may have tolerated it fine while you're doing it.
Right.
But the next day you go, what was I thinking?
Right.
So, now, some of the other options you could try is you could actually, and that's nice about these handles, they twist like this.
That is an advantage because it gives you options in that rotational component.
Actually switch shoulders here. Suddenly this one got better. So you can actually just hang back like this too. It's just a different option. You might not be able to get your arm all the way up.
Right.
Like you could do with regular hanging.
And then you can really control the amount of traction through the joint and the shoulder.
And you can try twisting like this too. Now, a lot of this occurs at the forearm, but there's some twisting that occurs at the upper arm too.
Right. So that rotational component, you want to make sure that you're not going to go into any rotation that creates any sharp pain. If you do, you stay away from it.
If I were to take a guess, Brad, the one that's going to feel better is to turn it out. External rotation.
Like your thumb would be going up.
Because that's how you move the tendon out of the way.
Right.
When we test tendons to see whether or not in the impingement is a problem, we turn it in
Mm-hmm.
and then check.
Sure.
Turning it out kind of clears it.
Yeah.
So stretching it that way may feel better. You can also actually grab the shoulder when it's in a relaxed position, push it down a little bit, and then go back. Now, this can also be done at 2 levels. If you get the hanging handles, you do get 2 of these, but most people put them side by side. So I don't know if this is going to be, this might be the kind where you have to get the entire set for the wall anchor.
Right. Or whatever. If you want to put eye bolts in the wall and do it,
Sure.
I've done that before too. And that would work as well.
Right.
But so you just need a different level. Or if you're using those straps, what did I do with that strap for the door? It goes in the door. You could do this on the door.
That's right there, Brad.
Oh yeah, I'm sorry. And this comes, you could slide this in the door. That's what it's made for, and then hook your handle on that.
Right. This comes only with the
bands.
Bands, yeah.
Yeah, yeah. These
yeah,
these stretch bands. Mm-hmm.
You want to show some of these at this level, Brad?
I mean, sure, you could.
You can lean back like this.
Yeah, and what I was finding, it works really nice with a chair with rollers on,
wheels.
which a lot of people don't have at home, but you may have a ottoman that does that, and then you can stretch and pull and maybe go out to the side. I would do this a little more cautiously. Let me do this so I can talk to the camera instead of.
Yeah, good point, Brad. Abduction might be another way to work on, especially I would say after maybe it's gotten a lot better going straight forward, then try going out to abduction.
Right. So what we're looking for, you're kind of
Straight out to
experimenting for motions that feel good and stretch that shoulder without sharp pain. And of course, then we got the McKenzie stretch like this, which actually,
good point, Brad.
yeah, this works really well for getting that. And then I can just squat down a little bit.
That's a really good point, Brad. You're actually getting some traction on it while you're trying to increase that.
And the handle makes it easy to hold on to. I can actually put my hand in there and just relax the hands, which could be important as opposed to squeezing it. You get more relaxed musculature up in the shoulder joint with that.
So let's go through the options, Brad. One, you can put it up higher.
Yep.
And you can hang with both of them.
Right.
You can hang singly.
With caution.
You can face the wall, and you can hang this way, leaning back.
Yep.
You can turn your arms to see if one's better. You can push down on the shoulder. Sometimes that feels better. You can do all the same ones at this level, except you can also add extension.
Right, which is
a good one.
So again, we're looking for things that increase range of motion while decreasing the pain. Again, the first day you do it, don't overdo it.
Yeah,
wait till the
just do a
next day.
couple.
Yeah. Wait till the next day, see how it responds. The next day, if you got better range of motion, less pain, then you can go a little more aggressive.
Then do a little more of that.
Right.
But again, don't go crazy.
Mm-hmm.
Hold off a little bit.
Right.
But also, we should mention our giveaway, which is not today.
Oh,
today is Saturday, which is the one day in which we switch from one giveaway to another. But if you go onto our website tomorrow and go to the giveaway section, we'll announce what we're giving away.
bobandbrad.com giveaway. Click on it. It'll show up. Or Facebook.
Facebook, yes.
Pinned to the top of the page. It's a wonderful
And we
gift.
should mention our podcast.
We really should.
We're really proud of this.
What is it?
Well,
Bob and Brad?
Yeah.
Bob good. Well, sometimes I forget the name.
I'm sure we'll have links somewhere for it, but we're really organized.
Yeah. Well, good luck with it. We're thinking about therapy now anyway.
Yeah, that's
so
right.
Good luck and be careful.